From the Toronto Star, I'm Adrian Cheung, and this matters. Across Canada, our fight against the coronavirus is just ramping up. Our frontline healthcare workers, doctors, nurses, medical staff, and cleaners are the last line of defense. They're putting their own health and safety at risk in order to protect us. So, what do hospitals and emergency rooms look like right now? Doctors and nurses, who, by the way, are used to facing serious, life-threatening cases, are stressed. They want to avoid worst-case scenarios that we're seeing play out in Italy and in many parts of the U.S., like in New York City, as this doctor describes to the New York Times.
We're exposed over and over again. We don't have the protective equipment that we should have. We're always worried that we'll be out of N95 masks.
Already, Eileen Davila, Toronto's medical officer of health, has confirmed more than 24 cases of healthcare workers getting sick.
People shouldn't have to die. People shouldn't have to risk death taking care of us because others won't practice social or physical distancing. This is simply not acceptable.
So today, we're talking to an emergency room veteran to take us into what the ER looks like right now, what doctors and nurses are most worried about, and what you can do to help them. We're joined by Dr. David Carr. Dr. Carr has been working in emergency medicine for nearly 2 decades, and his experience includes serving on the front lines during the SARS outbreak in Toronto in 2003. Dr. Carr, thanks for all that you and other frontline workers are doing, and for all that you will do.
Thanks so much for having me.
So first of all, I just really want to know, how are you holding up through all of this?
Yeah, it's an odd question because so much in society is just regular speak to ask a friend or a neighbor, how you doing? And it's hard to kind of shout out the answers that people are looking for, where normally we would just kind of say, yeah, things are great, things are tough. It's a challenging time to be an Ontarian, a Canadian, and it's a challenging time to be a healthcare worker, especially on the front line.
You work in emergency rooms for a number of hospitals here in Toronto. Can you give us a good sense of what you're seeing and what you're experiencing in those emergency rooms?
Yeah, it's an odd feeling. And one of the things you have to realize is that it's such a dynamic situation that changes from hour to hour, from day to day. And what I felt yesterday is very much can be something that feels different. What we've certainly noticed, the biggest change, and this is in all the hospitals, people that I interact with, is that there's been a real drop in our volumes of non-COVID related concerns, in that our overall emergency department volumes at this point have dropped. And it kind of makes you feel concerned as a physician, saying, where are all the patients that I'm used to seeing? I mean, clearly, yes, some minor and some chronic stuff can be diverted. People are resisting coming to healthcare, and I understand their fear. You just kind of hope that they're not delaying any sinister pathology that needs to be ruled out. So certainly our emergency department volumes for non-COVID related stuff and overall volumes are down now, but we also have the lens to know that this is essentially a little bit of a calmness before the storm that has not reached its peak.
Right. So most of the cases that you're seeing and you're dealing with right now are presumptive COVID cases.
Yeah, it's either really catastrophic cases, so high pathology, meaning I'm not seeing, I've hurt my knee for a few weeks. It's really significant trauma, significant pathology, heart attacks, strokes, seizures, blood clots, things that people can't avoid. And then obviously there's concerns about, is this COVID or I'm suffering from COVID, and there's that thing, and we're seeing that trajectory shift.
What do your shifts look like from the moment you put on your mask in the ER to the moment you leave for the day?
You know what? It probably starts before then. It starts from the night of sleep before. It starts from my drive to work. It starts from a change in practice where I'm, wearing different clothes and planning different things. And then I'm on shift. And look, I'm amongst the most passionate emergency physician. I love my craft just as much as the next person, if not more. Like, I love what I do. And obviously the day-to-day work isn't as much fun and is filled with a lot more stress. I've been in this business long enough that emergency medicine has never been a stressful craft for me for a very long time. I love it. I love the challenging, I love the differentiating the sick from the healthy. What's different is there's an element of anxiety. And I've never been anxious about being a physician. And I know myself and my colleagues, we're at a different stage because we don't know what lies ahead. You kind of look at New York or Italy or China and you don't want to be them, but every day is so different than the next. And I think it's that real fear of uncertainty. I'm used to treating infectious diseases. I've treated people with meningitis and tuberculosis and flesh-eating disease, which are highly communicable diseases. But I've gone in with those knowing the predicted course and knowing that I have a treatment to make those people better. And I've taken solace in that. And I've also felt calm for my own security in dealing with those patients. I think the challenge with COVID is, one, we can't help, or at least we're not sure if we can. And two, we also take more fear in terms of bringing that disease home or to our community, or the uncertainty of whether we actually can or not. And that's where this is different.
Among the suspected COVID-19 patients, how old are the patients who are coming in?
COVID doesn't spare anyone, but there's a large range. What we're seeing is it's an entity that affects people of all ages now. From what many of us have read in your paper and through social media outlets, it seems to be milder in children, and that's very reassuring for those of us with kids, that we feel that our kids will be fine. But if you look at what Theresa Tam said, I think she said 12% of those in hospital in Canada are under the age of 40. I'm pretty sure that's the stat. So it's affecting lots of people, and it's also probably reflective of those who've traveled, albeit about 88% of cases in Ontario are community spread, and that number is going to change every day and keep going higher. But it's certainly people who've traveled and certainly people who haven't social distanced. Lots of people are going to get this, and they're going to look in all walks of life, of all socioeconomic backgrounds, and of all ages. But I think it has to be a very clear message, and one of the groups that we're most concerned about is that mobile 20 to 30-year-old group who maybe have a bit of a feeling of invincibility because they're young, without dependence, without responsibilities. And certainly social media has borne out that we're seeing all these examples of partygoers and spring breakers, and you really want to make sure this message, if you want to help people, you want to make a difference as a 20, 30-year-old, get that message out there.
Have you seen a sharp increase over the last week in the amount of patients coming in with symptoms that are pretty consistent with the coronavirus?
Yeah, I would say every single day there's an increase. I mean, if you follow the stats as carefully as I follow in Toronto and Ontario, we're continuing to elevate. We're seeing more cases every day. Bearing in mind that with a delay in reporting, some of the cases we're getting reported today may be from 7 to 10 days ago.
Right, there's a delay.
There's a delay, right? So some of the data we're capturing is not even capturing the returning spring break travelers who would be a dangerous cohort that's been added in terms of infectivity. So we're still starting to see where in Quebec spring break was earlier, and they certainly have a higher, from what I understand with their weather, a lot more propensity to travel. You're seeing a lot more robust activity of disease in Quebec. You got to figure when we start capturing all that spring break or March break data, we're starting to increase. So just on sheer numbers, every day there's more cases to the next, and we see that and we feel that in the emergency department.
I know you can't get into the very specifics of a patient's case, obviously, but what does a severe coronavirus case look like? What physically, happens to that patient?
What you realize is this is a disease of profound shortness of breath that people have never experienced before unless they were asthmatic or something where they really understand what it's like to feel like they're suffocating. It's people with fevers and muscle aches and headaches. But really what brings them into hospital and what differentiates those who need hospitalization or emergency department assessments is a profound sense of not being able to breathe. And that is an incredibly frightening thing. And it's a really tough thing to feel that way. It's different than when you have bronchitis or the flu and you feel achy and you feel like you've been hit by a truck, but in a couple of days you feel well, because in those situations you don't feel the breathlessness. You just feel like crap. This is beyond that. This is not being able to walk upstairs and leave your bed because you're so exhausted physically and from a respiratory point.
And people have to be intubated.
Yeah, a small percentage does, and obviously it's a marker of severe disease. So that would be the end stage. You hope you don't get there, but a quarter of our ICUs, and a story I read today, is filled with patients with presumed COVID or COVID-related illnesses. And again, as I say, I think we're not near the peak at this point.
I've heard that one of the biggest worries in this fight, obviously, is to keep healthcare workers like yourself safe at a time when transmission is still climbing. What are the worries around personal protective equipment? Or for people who are listening, you may have heard the term PPE in terms of a shortage for doctors and nurses.
So sure, and I think that's where a lot of the fear and anxiety comes in. When you look at the healthcare workers in Italy, about 10% of healthcare workers were infected, make up the current epidemic in Italy. And I think they've had just over 50 physicians die. I'm not certain of the nursing numbers on that point. I think at the end of the day I feel confident in the PPE that I have and I can use, but I certainly don't feel confident knowing that if there ever got to a point where I wouldn't have it. And I feel safe with what I'm going to work with now, but I need to know that we have those resources moving forward. Certainly, you want to know that this needs to be ramped up. And this is a bipartisan issue when I hear whether it's Ford or Trudeau, depending where you're at, when I hear them talking about getting the stuff, we just want to know we have it. And I'm hopeful and confident that we'll continue to have it. But clearly social media, and this is just SARS and it's different with other pandemics, is it's an outpouring of knowledge. And these knowledge can be extremely difficult in that we see and hear tales of healthcare workers not having what they need or using makeshift devices. And that's really, really frightening to us.
Are you confident that there is enough stock? Because I know it's a slightly different situation, but in the US, we've read stories about how doctors and nurses, they get one set of PPE per day, and that's it. Are you facing any similar challenges here in Canada?
That would be the ultimate fear that all of us have, is rationing. We want to use smart consumption of PPE, but we don't want to use rationing that would endanger the provider. Clearly, we can't be using it for things where there's no evidence. So, for example, we use these N95, which is a really heavy-duty mask, for procedures that generate aerosolized particles, such as putting a tube down someone's throat. We got to make sure that people aren't wearing those in supermarkets and on buses. We have to make sure we have those vital resources. We have to be smart about them, but we got to make sure that no one puts their life at risk by not having what they need, which the science supports they need to wear.
What about ventilators and beds? I know when it comes to flattening the curve, that's one of the biggest concerns too, is that our healthcare system can't become overloaded with patients.
Certainly, it's comforting to know that there are critical care networks in the province and the country that are assessing things, that hospitals and governments have purchased additional ventilators. I think that when we look at successful countries, when we look at countries who have very low mortality rate, and Germany would be the one that really screams out, one of the things that's striking in Germany is their ratios of the number of nurses that they have per 100,000 people in population. And when you look at Germany and South Korea, it's also looking at the number of critical care beds they have. This is about space, this is about personnel, and this is about equipment. And we have to make sure that we, as a population, have this. And when you look at Canada, we have about 14.4 intensive care beds per 100,000 people, I think is the number. And every province is different. The countries that do well with this are the ones that have the highest number of hospital beds and highest number of critical care beds per 100,000 people in the population. That is a key metric that moving forward, when we move past this pandemic, provincially and federally, we will have to see whether we need to make adjustments.
And you want to obviously avoid a situation like Italy.
It's so important. It really stresses what we can learn from Italy. And Italy and the Italians have been our most valued educational tools to help prep us. And you just got to hope that this 3 weeks, which we are behind them, has given us some time to learn from them. But if you look at two cities, if you look at the region of Lodi and Bergamo, and you look at the social distancing and the impacts and measures that they had in two communities, it's like worlds apart and flattening the curve. But if we make this a priority, if people in Ontario want to save people's lives, they have an opportunity to do it with a much stronger tool than I do. I don't have great treatments for people with COVID. The great treatments with COVID lie in the hands of the citizens of this province, this city, and this country.
David, speaking about past history too, you were in emergency and doing frontline care during the SARS outbreak. That was also a very critical time. How does COVID-19 compare to SARS when it comes to the scope of what we're talking about?
So I was just completing my residency at that time with SARS. But what I can tell you is SARS was a different thing. Remember, SARS became really limited to an experience in China and Hong Kong, and then into a few hospitals in Toronto, and then throughout Toronto. And it became really a healthcare workers who were getting it. And that was a really frightening time. And I knew personally many healthcare workers who had it. But SARS, and the key difference with SARS is people were not infectious when they were asymptomatic. So the real thing that makes this virus so tricky and so fastidious is that it spreads in people with no symptoms, either those who will never get symptoms or those who haven't got symptoms yet. Whereas SARS spread in people with severe symptoms only. So it was easier to contain that beast. But what we've learned from the Diamond Princess, as much as an unbelievably botched situation, we've learned that many of the people who were tested, because if you test broadly, you get information.
The Japanese government has been questioned over its quarantine strategy, namely the decision to keep people on the ship where the infection could spread.
There was many people on these boats who had no symptoms. And it taught us to be fearful, because if we could have asymptomatic transmission, how do we isolate? How do we contain? And it led us to realize that the only way to contain this is through social distance and social isolation.
You almost have to assume that you have it, and perhaps you haven't shown symptoms.
That is the key message I think you need to get out there today. And what I always tell people, whether it's family members, whether it's patients, whether they have a cough or a cold, whether you have no symptoms, is you need to live your life like you're COVID-19 positive. You need to do that in protecting others. You need to stay away. You need to avoid unnecessarily travel to places like you're shopping. You need to maybe do minimal amounts of obviously just getting your core groceries once a week or however long you can last. But if you live like you have it, then you can make a difference.
There's one part of this that is obviously on patients and on us, but I know that there's also a huge worry about the mental health of healthcare workers, that this is a huge weight to bear. What do you feel are most doctors and nurses' mental state right now? And is there almost an expectation that healthcare workers will become sick like we have seen in other countries?
Yeah, look, I feel that I'm proud to work at hospitals where mental health has been prioritized, where physician wellness has been something that is very much on the forefront, and to have psychologists and psychiatrists available. I find that our chat groups that we can look to friends and virtual hangouts have been really helpful for me. Obviously, the need to exercise regularly, to sleep well, to eat well is probably more essential than it's ever been. But I get it. We just are leaning on each other. One thing about healthcare workers is we're all cut from a similar cloth, and we get it, and we're there for each other, and we just need to continue to be there. But I'm certainly worried about the mental wellness of all of us, of myself, my colleagues in the healthcare workers, and then, of course, those outside. I worry about my own kids who will be out of school and out of the things that they love to do, their hobbies, their activities, their summer camps, things that I worry that it's not healthy for them to stay at home all the time. And I know when this ends, life will be different, but I know it will be an uplifting time for a lot of us. And I'm so excited to get there. I'm just not excited about the trajectory that we have to live through in the next weeks to months.
And David, you have a family to think about as well. I've heard of doctors thinking about, should they rent hotels? Should they not go home after their shifts because they're afraid of giving it to their family, or that they are self-isolating when they're at home? Is that a different kind of separation that, we're all feeling quite lonely right now, but I think is that a different level that many people on the front line are facing?
For sure. I mean, we started this call talking about what I think about when I go to work, but there's also what I think about when I come home. And my routine's different. I no longer launder any of my own clothes. I have complete changes. I go through what I call my hot zone, which is I go through a garage entrance or side entrance into my house. I put my shoes in the garage in a cold surface, and then I go straight downstairs without acknowledging anyone. And I take a really long shower and really clean myself off before I'm then part of my family again. And I think lots of us, I'm in a 2 healthcare worker family. My partner's also in healthcare. So there's that added stress. And the other thing is most of us have relied on childcare through a daycare or nannies or grandparents. And you know, one of the hardest parts is for my parents, we've taken away our children from them because we just can't rely on them, and protecting them is amongst the most important thing in this epidemic. We have to protect our parents and grandparents. But yes, there's no doubt that the fear of bringing that home is something that's great. So the shift doesn't end, and the unknown, I think this all contributes to our mental well-being.
David, just one final question here. I know a lot of people will listen to this and are wondering, what can we do to help? How can we help our frontline doctors, our nurses, our healthcare workers? What can we do to buy you guys more time? What advice do you have?
Never, ever in history has it been more important for people to make a difference than right now. You just can't go outside. I won't use swear words or anything, although tempted, but you just need to stay home. You need to limit any outdoor exposure. When I see people walking with people as a frontline worker, I tell them if they're not in the same family, you need to stay apart. But the greatest way to make a difference is to stay at home and to stay distant. Stay in your nuclear family. Reinvent that. It's a real challenge in the way that we've lived our life. But through internet and social media and Netflix, I think a lot of us can get by in ways we couldn't get by before. And you please have to do it. I think the hardest part is that people just, in theory, don't understand how important that is. And it may be that in some communities that might be seen like everyone's doing it so well, but I can promise you it's not happening enough. People can look at what's happening and think that we're making great strides. There's tremendous room for improvement. And this is a disease that the people of Ontario and Canada will solve and will treat. It will not be healthcare workers. It will be you.
David, thank you so much for taking the time. Really appreciate it.
My pleasure. Be well, stay safe, and stay inside.
And that is Dr. David Carr. He is an emergency room veteran and has been working in ERs across Toronto for nearly 20 years. That's it for today. Thanks for listening. This Matters is hosted and produced by me, Adrian Cheung, Saba Aitazaz, and Raju Muthar. Produced and mixed by Sean Pattinen, and our director of programming is JP Fozo. Our show theme music is by So Called, and our episode music is by Mike DeAngelis. We want to hear what stories matter to you. Please send us comments, questions, or ideas to thismatters@thestar.ca. Please consider supporting the journalism the Toronto Star newsroom does at thestar.com. And don't forget to subscribe to This Matters on Apple Podcasts, Spotify, or wherever you listen to your favorite podcasts. Let's talk soon.